Good morning, everybody. Welcome to the Ag Industry Stakeholder Call. It's been a while since we've had one of these, and we've got a full schedule, so I'm going to make a few comments and then we'll jump right into it. So the ag and forestry industries have been leaders, in my mind, in this pandemic from the start. We're critical infrastructure, and we've been supplying food. Okay, sorry about that. Well, I want to make a few comments about the ag and forestry industries. We've been leaders from the start in this critical infrastructure, and also agriculture knows a little bit about disease control and prevention. So on the animal side, we've got a lot of experience with that, and I think we can be leaders also in disease control and prevention. This past week was all our parameters in Tennessee were up, from hospitalization to number of positive cases, et cetera. So it's concerning going into the flu season, and I think we can help with that a little bit. So we know this is spread by direct contact. I'm not trying to get in Dr. Phil's area here, but it's spread by direct contact mostly. We need to keep our distance, no hugging and that kind of thing. And we certainly need to wear a mask. And there's lots of evidence that shows that outdoor environment is a lot lower risk. We need to, and I'm doing this on my own farm. We're protecting our inner circle. I have an elderly mother-in-law that lives on the property there, and we're doing what we can to protect that high-risk group on our farm. So we need to do that. And I heard this morning on television that there's Pfizer saying their vaccine is going to be 90% efficacious, which is fantastic. I think the flu runs nearly maybe 65, 70%. So that's good news. That's almost as good as blackleg, I think. So we'll see how it, I don't know when it's coming, but it may be next summer before we have that distributed to the masses. The budget hearings are coming up for us real soon here. We've gone through the budget process of a 12% reduction plan, and then we've got a 2% plan. And so we'll see how that all meshes together as we go through this budget process. I would point out, I was at the Economic Recovery Group meeting last week, and a couple of commissioners talked, and Jeff McCord was saying that in an ordinary year, the state pays out about $200 million in unemployment benefits. And so far this year, they've paid out $6 billion. That's $6,000 million, if you can get your head around that. So sales tax revenues are looking pretty good, better than expected, but we think some of that is due to the increase in disposable income caused by some of the federal monies that have been coming in. And I think I heard David Gargano say that internet sales were up nearly 300%. So as certain sectors of the industry like hospitality and the music industry are really suffering right now, but there's other sectors that have increased. So want to talk about that. And one last thing is that ag enhancement, Keith will talk about this more in detail, but I just wanted to touch on it for a second. So ag enhancement this cycle, applications are record high again, which is even with some maximums imposed on some of those programs. We expected maybe a steady or maybe a decline in applications, and we had a record number. So that just goes to show you the demand for that. We continue to focus on providing critical infrastructures here at the department, and also our mission is to focus on ag and forestry industries as far as recovery. And we've got a pretty good number of programs to do that. So between the Ag Enhancement and the Ag Enterprise Fund and the Corona Ag and Forestry Business Fund, this year in 2020, we hope to allocate nearly $80 million to the ag and forestry communities, and so that's a good thing. Okay, so that's the end of my comments, and we've got a very special guest today. We have President Randy Boyd from UT with us, and I'm right with you, Randy. Everything that we do is tied to UT in some way, and we really enjoy the partnership we have with you, and I wanted to have you on to give us an update on UT, and then we'd like to leave some time for some questions. So the floor is yours, sir. You're on mute, Randy.
There we go. Thank you. I thought I'd unmuted myself earlier, but I guess somebody muted me back. Well, thank you, Charlie, for the introduction. And just for everyone's reference, I had a moment of panic when I pulled up on the Zoom and I saw Charlie in a tie. When does that happen? But he is my boss, if you don't know that, as a member of the Board of Trustees. And you probably know this, but this is always worth reminding everybody that there's only one trustee that is designated by our bylaws, that always by the statute, that always has to be on the board, and that's the Commission of Agriculture. And that's because agriculture is such a central part of everything we do at the University of Tennessee. So we appreciate you letting me come and visit, Charlie. I was told that I only had 15 minutes, so what I thought I'd do is give a short overview of what's happening at UT, maybe give you an update on some of the things that we're doing in the ag and forestry industries, and then maybe leave a few moments for some questions. So from a macro view of the University of Tennessee, we have decided to make this the greatest decade in the history of the University of Tennessee, and that's in spite of the COVID pandemic that we're all facing. And I think the way our teams across the state have rise to the challenge is going to be one of our more defining moments. Our campuses, our extension offices, all across the state have done just heroic things to keep our students safe, to contribute back to the community. So I couldn't be prouder of their efforts. Just on COVID, just a couple of quick things. One of the things that we determined early this summer was that we're going to bring our students back. We're going to keep them safe and give them a great educational experience. And with regards to keeping them safe, we do a weekly survey where we check on the number of students on our campuses that have COVID or have active cases versus the population in general across the state, which between the ages of 17 and 25. And as of last night, here's my new numbers. In the state of Tennessee, in the general population of students or people between the ages of 17 and 25, 1.07% have COVID. If you're at UTK, UT Knoxville, 0.23%, UT Chattanooga, 0.45%, at Martin, 0.38%, at the Health Science Center, 0.25%. So we're either a fourth to a half safer, have half as many cases as you do in the population at large. So we're either 2 to 4 times safer on our campuses than they would be back home. So we're doing a great job of keeping them safe. And it kind of makes sense when they're wearing their masks, they're managing, we're keeping group sizes small. And so we have a more controlled environment. So I think all of our campuses have done just a tremendous job of making keeping our students safe and keeping them in school and graduating. And speaking of that, I just had a board meeting 2 weeks ago, which I updated the board on some really some important fall stats. So we set a lot of records this fall. Know that across the country, if you're a public higher education institution, your enrollment dropped by 16%. So on average, most universities drop by 16% for all the reasons you might imagine. Well, at the University of Tennessee system, we were up 1.9%. And at UT Knoxville alone, it was up 5%, which is incredible. So we set a record this year in number of new undergraduates, 52,559. We set a record in enrollment of graduate students, a record graduating rate. Over 12,000 students graduated with an undergraduate degree this year, and a record of graduate students graduating. So we feel great about enrollment and how we've been able to recruit even in tough times. On the research side, we also set a record this year with $431 million in research. That's another increase of 1.9%. So I think overall, on a macro level, the university has been doing great. We've had some financial hits. People always ask about that. We reported that to the board. The total lost revenue is $94 million across the system. However, we had a lot of offsets between CARES Act funding, between cutting costs, between not having to, people don't spend money on food. We don't actually have to produce the food. So the net actual impact to the bottom line for the UT was only $9 million. And we had significant enough reserves to be able to manage that. So I think the team has done a great job of responding to that challenge. One of my personal biggest accomplishments this past year is getting around to all the extension offices. I'm told that I'm the first president ever to go to visit every one of our 95 extension offices. I love getting out into the communities and meeting with our teams and seeing the great work they're doing at the county level. I remember stopping in Franklin County back in the spring during the middle of the pandemic and seeing how they were stepping up by distributing food to the needy at one of the local high schools. So they needed people to help provide food. They were there to do that. The governor called and said that they had a potential issue with county health departments not being able to distribute the 5 million PPEs that were bought. And so all of our extension offices volunteered to be another point of distribution and helping distribute the PPE. So they've just done a tremendous job at every county level. So we're wanting to do everything we can to support them. When I go around and visiting with the extension offices, I always ask them for their wishes. They always tell me things that they need. The biggest wish that our extension offices ask for is additional staff. Many years ago, when we had to make some budget cuts, we unfortunately cut in the counties where the county match was lower, which kind of makes sense from a financial perspective. If one county is going to give you a 50% match and another county is only going to give you 20%, financially it makes sense to cut the places that are only going to give you 20%. But if you think about it, what that means is the poorer counties, the people that need us the most, was where we cut. And so we've got a lot of our distressed counties and at-risk counties that were understaffed. So last year, knowing the governor is a big fan of extension and a big fan of 4-H and a big fan of rural communities, we asked him for an extra $2.3 million to add 32 new extension agents. And in last year's budget, he put that in. Also, he added additional money for TSU, our partners, at a lot of the extension agents offices. Unfortunately, because of COVID, those things, everything that was extra got cut. However, we're hopeful that we'll be able to get that back in the budget again this coming year. Tomorrow, I've got a meeting with the governor and his staff to present our budget request. He only gave me 3 minutes, which it doesn't give me very much time. So I figured, when you only have a limited amount of time, talk about the most important thing that you want to talk about. So I'm going to just talk about extension, and we're going to do everything we can to get that our 2.3 million, and I'll be making a pitch for TSU as well, because they need theirs just as much as we need ours. And so we're hopeful that we will get that support. Just a couple other quick things regarding UT's efforts around agriculture. And kind of speaking back to our extension offices, there's a Dr. Heather Sedges in the Family and Consumer Sciences that's leading a 7.5 million Southern Region USDA NIFA project to address stress among farmers in rural communities. So that was a big grant and a big initiative that they'll be leading. The Center for Profitable Agriculture and Department of Animal Science are combining their expertise with experts from Kentucky and North Carolina to enhance the success of the regional dairy business. The team has been awarded a $6 million grant from USDA Agricultural Marketing Services, part of the agency's diversifying income and adding value to manufacturing dairy products. Another big effort that we've been working on the advocacy side is to obtain a transfer of land at Milan from the U.S. Army to the Milan Ag Research and Education Center. We appreciate all the support we've been receiving from people all across the ag industry. We've been doing research on this site for over 40 years. and we've conducted over 200 research trials annually. And this is actually the place where we develop the no-till and conservation tillage technology. So we're really excited about the efforts that we have underway to get that transfer. We've had some promising developments over the last 30 days. We still have a ways to go. This getting legislation or anything done in the federal government, and especially with the Department of Defense, turns out to be very, very slow. But as it stands now, there's nothing that really is, nobody's really opposed to it. It's just the wheels of bureaucracy in Washington and getting those things moved. But we're hopeful that hopefully in 2021, we'll be able to complete that transfer. I'm probably close to about 10, 11 minutes there. There's an endless amount of great news to talk about with regard to UT and things that are happening, but I'll stop there and see if there's any specific questions that any of you might have about UT or our efforts to support agriculture and forestry. Well, if there's no other questions.
Okay, I've got one.
Okay, thank you.
I was locked there and couldn't get unmuted. Sorry about that, Randy. So I know this is the pandemic. It's a tough time for universities, financially for sure. So how does UT stack up against other universities as far as financial stability?
Well, I think we've done tremendously well, and I mentioned the negative impact of like $9 million, and most of that is on auxiliary services or revenue, like with housing and food and parking and those type of things. But the core part of our enterprise is actually incredibly solid. There's three key areas in which we get our funding. One is from the state, and the University of Tennessee, the state of Tennessee, as opposed to many states. Into Bloomberg this morning, they're talking about how New Jersey's debt is going to be downgraded significantly probably this week. The state of Tennessee has AAA ratings on all across the board, and we've managed our budgets tremendously. So we have this year we didn't get the increases like I mentioned, like for extension and some of the other things we were asking for. We didn't get a cut either. So our revenue, a third of our revenue comes from the state, and that's the same. And then another third of our revenue comes from tuition. And as I mentioned, we had 0%, by the way, important thing to highlight. We had a 0% increase in tuition this year across all of our campuses, the first time we've ever done that. But in spite of having no increase in tuition, we had a big increase in enrollment. And because of that, revenue from enrollment actually increased. And the third area which we get revenue is from research dollars. As I mentioned, we had a $431 increase in $400 million in research coming in, which means that also increased by 1.9%. So the three pillars where we get our revenue, we're actually either up or flat. So we're actually in good shape right now. And compared to other states are not doing so well. In the state of Tennessee, I think most of our other 6-year or 4-year institutions, the other 6 what they call locally governed institutions, are doing okay. I will say though that our community colleges are really struggling right now. They've seen a dramatic dip in enrollment, which is concerning.
Yeah, and there's somebody gave you a compliment, so you better take a look at that on the chat box.
Let me put that up here.
Because you don't know how often you're going to get a compliment.
Oh, well, this is true. Well, that's an easy one to accept. It's always great to hear from our partners at TSU, and one of the things we want to do is continue to build that, and we both win together.
Yeah. And then one last thing, you may not even want to comment on this. What about UT football?
Yes, we're going to play 2 more games, and we're going to sell out all 25,000 seats.
Okay. All right. Any questions?
This is Jennifer. Yes.
Yes.
Great numbers for your active cases on all the campuses, but especially UTK. Just a question: is part of that how much would you estimate is online with the students, even though they're living on campus, as opposed to being able to socially distance in person in their classrooms?
Well, that number changes regularly because faculty get the choice of whether they're going to teach in person or not, and sometimes they'll change for a variety of reasons. But the last number, roughly at UT Knoxville, 50% is totally online, and 50%, or this across the system, I'm sorry, 50% totally online and 50% some type of hybrid. So it may be one or two classes in person or a lab in person. Unfortunately, it's not equally distributed like that for every student. So, for example, if you're a freshman, you get a lot of really large gen ed classes, it's conceivable, maybe probable, that all your classes are online. If you're a senior in biology, there's a likelihood that maybe 90% of your classes are in the labs. So it varies depending on your discipline and what year you are in school.
After the pandemic, Randy, does this mean that this opens the door for more online classes? Do you expect that to be a higher percentage?
It definitely will be a higher percentage, and we'll be doing them better. And I think there will also be more hybrid learning. So the idea of 300 students piling into a huge auditorium for a lecture really just doesn't make a lot of sense. So that part probably you'll see more being replaced with online. But on the other hand, certain labs and in-person instruction, students and faculty prefer it. And so there's a and they get they have the opportunity to interact with students, get the opportunity to interact with other students, and it's just a part of the learning experience to be able to interact with your peers. And that's a little more difficult, actually a lot more difficult on Zoom. So we'll be doing more of it, but not to the level that we're doing now.
Okay, here's another question, Randy. I'll let you look at that. See, well, I'll just read it too. How are you addressing employee morale?
Yeah, so we're trying to do everything we can to stay connected with, and this, I don't know if this is for staff or for faculty or this is just in general, but one of the things that we've all worked hard at is just try to do more communications than we normally would have. If we were coming into the office, we might maybe connect with some of our colleagues once a week, maybe once every 2 weeks. But now we're making more of a concerted effort to have regular get-togethers online, to be able to connect. But I think the morale and stress level being connected, I think is well documented. It's difficult for a lot of people, and it also very much we do pulse surveys in which we're trying to get a sense of how people are coping, and it varies dramatically. If you're old and an empty nester like me, with a beautiful wife at home that will make you lunch, and you got an office at the house, working at home is actually pretty nice. It's a very easy. When we do the surveys, and alternatively, you've got a single mom with children that are supposed to be in primary school that aren't, small home working from her kitchen table, trying to manage all those things. It's really, really difficult. So it varies dramatically depending on your personal situation.
Okay. I'm not seeing any more questions. We do really appreciate your support of agriculture. We hope that continues, and we're thankful that you're in this position.
Well, thank you, Troy. Thanks for having me. And I'll let you guys continue on with your meeting. Look forward to seeing everybody in person one day soon. Thanks so much.
Okay. Thank you.
You bet.
Okay, Zach, you are certainly rocking that Stetson. I'm glad to see somebody wearing a Stetson in Washington. So the floor is yours. If we can get you, looks like you're muted. I'm not sure whether. Are you good?
Can y'all hear me?
Yes, that's good.
Okay. All right. Good. Sweet. I had a call in on my cell phone, but used the camera on the computer. Yeah, I appreciate your comments, Commissioner Hatcher. It is. I agree. It is good to see people who share my love for agriculture. And like I said last time, I couldn't be more excited to join a great team of public servants. What an exciting time in federal policy, right? We're coming to a conclusion of an election here. NASDA is uniquely positioned to assist with the transition. And one of the things I think is critical for us is we probably have about 7 key points that we're going to be extending. And we announced them recently, I guess about 2-3 weeks ago. We did a pretty substantial post on working with whatever administration going forward on expanding market access. That's going to be a critical point that we're going to be advocating for. We had a really successful trinational accord with our Canadian Mexican partners, the largest that we've ever held. It was virtual, but we had a record attendance from all the stakeholders there. One of the other points that we'll be advocating will be protecting your workers, your essential workers or farm workers. Commissioner Hatcher, I know you'd asked me last month, where will we be on funding for local and state governments? I think a lot is still unknown. I would say it's a tick in the positive direction if we have a Biden presidency. However, it does look like the Republicans are going to control the Senate. So I would encourage those who who choose to advocate for more local and state government funding in the next Corona relief package to let your Republican congressmen and senators know that a dollar given to agriculture and a dollar given to local and state government is a good investment and it's being used well. We've been doing that. We've been advocating to say that the last round of CFAP funding that went out, I think 12 or 13 state departments of ag got the funding, and the work that they did was instrumental and critical in the COVID response. One of the other points that we mentioned was keeping food safe. We've been working diligently with FDA and their area of new food safety on just developing that relationship and having that team really incorporate NASDA and the state departments of ag with any notice of outbreaks and just really increasing that level of communication, which has been a great work. Hats off to Frank Giannis and his team, who've really viewed agriculture as a great partner and is really committed to working with us. I indicated this last time, we're going to be continuing to advocate for expanding rural broadband and getting the areas that need that funding help. I think COVID has shown us all that working remotely, that internet access, reliable internet access, high-speed internet access is the great equalizer. It is something that we all need to be able to be effective professionally now. So it needs to be at the forefront. One of the other points that we have is enhancing resiliency in our food system. That really just kind of talks to some of the points we were just making. I think COVID has shown us a lot of that. The other two, one is investing in climate resiliency. We definitely think climate will be a priority for a Biden administration, and making sure that agriculture is being proactive and not reactive in that conversation will be critical. And then NASDA in its particular seat where we are, we just had a very contentious last couple months, is to help, have a united voice to agriculture and help work together. I mean, the greatest thing about working for NASDA, and Commissioner Hatcher, I know you've been at this a long time, is ag's a bipartisan issue. It's something that we all work together on to help farmers, and NASDA is such a great place because you and your peers consistently just come to help each other and be advocates for each other. So that's kind of the big picture stuff that we've been working on, and we will continue to work on. I imagine I'd even have more information to share tomorrow because this is the first day back after an exciting weekend. But NASDA is going to be very involved in the transitioning process and trying to make sure that ag is at the forefront of whatever happens going forward. Happy to answer questions, Commissioner, or any of your teammates.
Well, I've got one, and then maybe others will jump in here. So, and you might not can answer this till you get a better feel, but under a Biden administration, would you expect trade policy to change much?
Well, that's a great question. I don't Commissioner, I don't personally feel comfortable enough on trade to answer that, but I will. Dr. Glenn has been leading the trade group, the trade policy area since Max left, and it is an important question. So I will touch base with her and just get a general reaction to that. I don't feel comfortable enough knowing the political mechanisms in place with the UMCA and what the different viewpoints are from the high level of the administration would be. Obviously we have a contract, we have some commitments. I know there's going to be a lot of work done there, but I will follow up with you on that. And I apologize. I just want to make sure I give you the best answer possible.
I didn't expect you to have a good answer, really, because I don't think anybody knows.
Sure.
So next call, we'll have a better understanding, I guess, maybe where things are sitting.
Yeah, honestly, I think we'll know a lot more in a lot less than a month. We're 70-ish days out from an inauguration, and they're going to move quick with a lot of their priorities. They're going to make a lot of announcements on what are going to be the things they're trying to get accomplished. Obviously, I think critical will be, Senator McConnell, Representative, Speaker Pelosi have really said that we do want to get a relief package done. That's going to be an area of focus, is trying to make sure that we get state and local government included in that the best that we can. So that'll be a priority for us. Okay.
Well, Zach, we appreciate the update. Look forward to next time. And yes.
And I was going to say one other piece, Commissioners, we'll be reaching out to you. We're also reviewing the Tier 1, Tier 2 priorities. I know you sit on animal ag, correct?
Yes.
Yeah, so we'll be reaching out to you to schedule a meeting to review some of the priorities going for next year on that committee. So you look for a note from us on that, okay?
Okay. Well, thank you so much. Tim is telling me that there's something wrong with WebEx, so you'll have to unmute yourself. And Dr. Phil, we're anxiously awaiting your report.
Good morning, Commissioner. Can you hear me okay?
Yes, you're not going to shock us, are you?
I'll do my best not to.
Okay.
Let me share my screen here, and I will get my slides pulled up. Can you see those okay? Great. Well, good morning, everybody. Mary Margaret Phil with the Tennessee Department of Health. I just want to share the normal data update, and then I have a little information about vaccine development to share at the end that hopefully everyone will find helpful. So as a reminder, these are our three big buckets of data points that we've been tracking. We'll start with our more non-specific syndromic surveillance from our emergency department data. And really just what I'll highlight is that this blue curve, which is the COVID-like illness, has really mirrored our peaks and surges and valleys in our traditional case count. So we did see an increase in that syndrome in hospital emergency departments in early October, and although it's plateaued a bit, again, sort of a non-specific indicator. We do see that our influenza-like illness syndrome data remains fairly low, and we'll of course watch that closely as we head into flu season. So if we switch now to look at our case count, so this is our number of cases by day, by specimen collection date, and if you focus on that red line, what I'll just really draw your attention to is now through the middle and end of October, our average number of cases on a daily basis has actually exceeded our summertime spike back in mid-July. This graph shows that in a different way. This is the number of cases reported by week. You can see we had a new high reported in MMWR week 43, which was 2 weeks ago, with almost 18,000 cases reported statewide. And we've really, that's fairly stable at right around that level, 18,000 cases a week now for the last few weeks. When we look at our testing data, we're rapidly approaching 3.9 million PCR tests that have been conducted. We're still averaging, 20 to 30,000 new tests reported a day. There's been a little bit more variability in the last week or two. Some of that is related to an upgrade of our surveillance system, so that's a little bit of artifact there. But there's still a lot of testing happening across the state, which is certainly a good thing. I think the worrisome trend associated with testing that we've seen is that our percent of tests that are positive have increased fairly steadily over the last month. So we have two lines here at 10% and 5%. Our goal is definitely to be less than 10 and ideally less than 5. But you can see over the last, especially 2 weeks, we've had many days where our daily percent positive was over 10%. And really, no days where we're even close to that 5% threshold. So our 7-day percent positivity average is now 10.7%, and our 30-day average is close to 9.5%. And so, this is really a marker of the fact that, there's more disease in the population. Even if we were testing more, if there was good control of the disease, we would actually expect our percent positivity to either be stable or be trending downward. So, I think this in combination with the number of cases are just really important metrics to watch to understand the amount of disease that's present in communities across the state. If we switch to talk about deaths, we are just shy of 3,600 COVID deaths in Tennessee. Our case fatality rate has remained fairly stable for the last month. It's about 1.4%. Overall, it's 1.3%, and that is still very low compared to many other states. We're kind of right in the middle of the pack, around, I think, 25th nationally in death mortality rate last time I checked. I think this is largely due to our great access for testing in the state. We're better at detecting cases of mild and asymptomatic disease in Tennessee than I think many other states are. However, and especially when you consider our case burden, we're generally in the top 10 for case rate nationally. So we're certainly glad that our death rate is lower. But again, 3,600 deaths are a lot of Tennesseans. And then, the last metrics that we've been watching very closely, especially recently, are related to healthcare system capacity. Even back to March, a big focus of all of these mitigation efforts are to flatten the curve and ensure that we have adequate capacity in our hospitals to care not just for COVID patients, but to care for people with other diseases and heart attacks and strokes and other needs. And unfortunately, we've seen a fairly substantial rise in our hospitalizations over the last 6 weeks or so. We've been over the 1,500 mark in terms of COVID patients statewide, several days now in the last week. And COVID patients represent somewhere around 15 or 16% of all hospitalized patients statewide. There's quite a bit of regional variability there, but overall about a quarter of patients in ICUs across the state have COVID. And we see that, there's a handful of hospital systems statewide that have suspended elective procedures that require an overnight hospitalization stay, as hospitals, are very closely watching their capacity to care for patients and ensure the high level of care that they should deserve and should get. And so they're trying to ensure that they don't get completely overwhelmed in the coming days and weeks. So this is a big area of focus, something that we talk about with the Unified Command Group on a daily basis, lots of close work and collaboration with the Tennessee Hospital Association and others to ensure not just adequate beds, but adequate staffing to care for patients in hospitals. I want to share this graphic that circulated on social media. Some of you may have seen it. I think it's a helpful way to think about these different prevention measures that, I've been talking about for months now. We all know the routine to wear a face covering and practice social distancing and stay home when we're sick. But I think it helps to think about it in this sort of Swiss cheese type example. So this is a similar model used in healthcare quality improvement, but the idea is that, each one of these prevention measures by themselves is not perfect. They all have holes in them. But when we line enough of them up in a row, then we eventually get to a point where those holes don't align and viral transmission can't happen and the virus can't get through. And that's why it's so important not just to wear a mask, but to avoid tight spaces with poor ventilation with a lot of other people. Why it's important not just to stay home when you're sick, but to also wear a face covering and spend more time outside and wash your hands regularly. And so this graphic really gets at the idea that there are personal responsibilities that we all shoulder, all those things that I really just mentioned, and then also shared responsibilities, many of which, we in public health are responsible for, ensuring access to testing and tracing, vaccine development, ensuring that there's opportunity for people to be in outdoor spaces or spaces with good ventilation. And it's really all of those things together that will improve success at decreasing the risk of transmission. So I'm going to skip this just for the sake of time and talk a little bit about vaccine development, just because I think this is an area of focus and the news this morning was fairly timely. So there are now about 5 different vaccines that are in phase 3 clinical trials in the United States. The top 2 highlighted in blue, the Pfizer vaccine and the Moderna vaccine, are the 2 that are the furthest along in the phase 3 process and that we expected to see results for soonest. The Pfizer team actually announced this morning that they had received some preliminary data that looked like their vaccine could be up to 90% efficacious. And so I'll translate that a little bit. There's a little spin there from the company press release. It is certainly highly encouraging news, and I think we're all really excited to see that these approval processes and evaluation processes are moving forward in a systemic and timely fashion. But what they basically showed was that in the group that received vaccine, there were 90% less symptomatic infections. So just so that people know how this works, they enroll tens of thousands of participants, half get placebo or a fake vaccine and half get a real vaccine. And then they evaluate for cases of disease and, of course, side effects and other, adverse events that could happen. They don't test people on a regular basis. They test them if they get symptoms. So there could have been cases in the vaccine arm that were asymptomatic and not recognized. And they don't challenge people with disease either. So these are regular folks, many of whom are in our own communities that volunteered for these trials. And so some of them are higher risk for exposure and some are lower risk. So there still will need to be, more data and understanding, but I think based on the rumblings of colleagues across the country, I think folks are very encouraged and excited to see this moving forward. I do think one really important point worth noting for the Pfizer vaccine is that it requires ultra cold storage at -70. So that requires a lot of special equipment. It is a 2-dose vaccine that requires about 3 weeks between doses. So I'm not going to belabor all of these. I do want to just talk a little bit, if you'll bear with me and being a science nerd for just a second, about mRNA vaccines. These are really a new vaccine type that we're seeing be used for COVID. I think it's very encouraging and exciting, but it really harnesses, if you think back to biology class in 7th grade or in high school, everyone remembers that there's DNA in our cells and genetic material, and then there's the transcription and translation processes that ultimately take that DNA, that blueprint for building blocks and proteins in our cells that then allow those proteins to be made. And so basically what these vaccines do is they insert synthetic mRNA, which is sort of the translated version of our genetic code, of the DNA in our cells, and basically uses our own body cells to create viral proteins from the COVID virus. Therefore, it's not an infectious virus. It can't give you COVID. It can't make you sick with something that could make others sick. But it harnesses our own biological processes to make these viral proteins that then our immune system will see and create an antibody response to. So this is a new type of vaccine, and we again see that several of the vaccine type prototypes that are in development and in approval are this mRNA vaccine. So our group in Tennessee with our Vaccine Preventable Diseases program has convened a large stakeholder group. I won't go through all these names, but just rest assured that there are representatives from across the state, from across interest groups to discuss the vaccine approval and dissemination process. And that group is meeting on I think a bi-weekly basis. This is the sort of tentative timeline. So we expect that once a vaccine receives emergency use authorization from the FDA, that there will initially be limited doses available. And then there'll be this very rapid ramp up before we have a much higher or larger number of doses available that will meet the true demand of the population. This lag will not be as long as it might have been, since many of these vaccine manufacturers have already started mass producing this vaccine.
We lost your audio there, Dr. Phil. We can't hear you for some reason. You want to chat in there, Tina? We can't hear you. Can you hear me, Tina? You might have gone to mute again for some reason. You can.
Sorry about that. Can you guys hear me?
Yes, can now. Go ahead.
Sorry, my phone landline just completely reset. So let's try that again. So, so we recognize that because we're going to have limited vaccine at first, that we have to have a distribution strategy, and this is to make sure everyone understands. This is not a unilateral decision that we've made in Tennessee. We're incorporating guidance from the National Academies of Science, from the Advisory Committee of Immunization Practices, and others. And so this will really be a phased approach where the phase 1A group are really going to be highest risk healthcare workers that are caring for COVID patients. So people working in ICUs and emergency departments, first responders. Other healthcare workers will be in the phase 1B group. Again, recognizing that if we lose a third of our healthcare worker staff to COVID, that we can't care for our COVID patients. So that group is just so critical to ensure that that we have appropriate care for folks across the country. Phase 1C will be individuals that are higher risk with comorbidities like hypertension and heart disease and lung disease and obesity and diabetes, as well as older adults in congregate care, regardless of their underlying health conditions. Then we'll see other critical infrastructure workers, K through 12 and childcare staff, older adults, regardless of comorbidities, and then sort of the last groups will be children and younger adults and industry workers and all others. So again, and this may change over time. This is the tentative framework for right now, again, based on lots of national and state discussions with that stakeholder group, but this is how we anticipate that rolling out as we start to get doses of vaccine. And then just so people understand, we're currently enrolling over 1,100 vaccine providers across the state, at least one in all 95 counties, trying to enroll every single acute care hospital in the state to be points of distribution for vaccine. So we actually will place, the state will place orders with CDC to allocate to each facility based on how the number of those different populations that they may serve, and then Pfizer and McKesson and others through their logistical supply chain will ship directly to facilities, and those priority populations will be vaccinated. So again, I could talk about vaccine for hours, but I just wanted to provide kind of a high-level overview of that process and where we are. So I think just so everyone understands, you know, even with this news from Pfizer today, I think what I understand to be the timeline is that it will probably still be another week or so before, if not longer, before they apply for emergency use authorization from the FDA. That turnaround process could be a day or a week, and then there will have to be some final decisions made from CDC's Advisory Committee on Immunization Practices before we see a vaccine starting to be disseminated. So are there questions that I can answer?
I think there probably will be. I've got one though. So does it look like Pfizer will be the first one?
I think so. They're furthest ahead in the sort of the testing and approval process. Several of the other vaccine manufacturers have had to pause their trials for an adverse event that needed to be investigated or other issues. So I think Pfizer will probably be first, and then Moderna will be second. It doesn't mean that those will ultimately end up being the best vaccines available. I think time will tell with that, but right now I think we recognize that if they, as we expect them to be safe vaccines with some efficacy, then there is benefit in getting them out into the population.
And how many of them are mRNA?
I believe 2 are mRNA, at least. The Pfizer and the Moderna vaccines are both mRNA. The AstraZeneca and Johnson & Johnson vaccines are called replication defective vector vaccines. And then the Novavax vaccine is basically a protein subunit vaccine.
And if they are 90% efficacious, if that's what it turns out, that's good, because that could stop a disease outbreak in its tracks, could it not?
It could. My guess is that when we see it in the general population, that it's not going to be quite that high. We don't really see many respiratory pathogens for which we have a vaccine that has that high of an efficacy. And again, that efficacy data is based on symptomatic infection, and we know that about 40% of COVID patients don't have symptomatic infection, yet they're capable of transmitting to others. So again, my guess is it's not going to probably, the cynic in me thinks that it will probably end up being not quite 90%, but again, it's really encouraging, and I think, really exciting, to see that move forward. And certainly I think it's going to prove to be a beneficial vaccine.
Okay. Jennifer Houston, do you have a question?
Yeah, a couple. One, I guess I'm looking for a better answer than I've got. I've just heard a lot lately as the cases continue to rise and mask usage in states continue to rise. Obviously, you can make anything you want to out of statistics, but I've been seeing more and more of that about, well, mask usage rises, so are cases. I guess I'm looking for a more scientific answer than I've got on that. And the other thing is, do you all see that one of the biggest drawbacks to the vaccine is just the fact, will people get it? A lot of people don't get a flu shot. And I hear around just anecdotally, well, I'm not getting it. So no matter how good it is, if people don't take it.
Sure, yeah. So to your first question, I can tell you with certainty that cases are not rising because people are wearing masks more. We see in Tennessee that, our rural counties have a higher burden of disease and in fact have a 2.5 to 3 times higher mortality rate than our urban counties. And the vast majority of those counties don't have mask mandates. And, I can tell you, having traveled to many of them with the Unified Command Group, that anecdotally I see less mask usage. But again, it's not just masks, right? Masks are not a silver bullet. And I think part of the problem is perhaps that people are leaning heavily on masks, thinking that it will protect them, when they then congregate in large groups, or they, partake in other activities where they're very close together, or with poor ventilation, or, when they have a little cough, but they want to go out and do X, Y, or Z anyway. And it's, those are the areas where we really find ourselves in trouble, and there then can still be disease transmission even if people are wearing masks. They're not 100% effective. So, I would just encourage that it's really all of these factors taken together that we have to continue to practice to see disease transmission rates drop. And then to your second point about vaccine uptake, that is certainly a concern. We recognize that there are large populations of Americans that are hesitant about any vaccine, let alone a vaccine that there is the perception of there being a hurried or rushed process. I think we should all rest assured that, I've heard an interview with the head of Operation Warp Speed who said very frankly that if there was, political interference or any sort of pushing, this process forward in an inappropriate way that could compromise the safety of these vaccines, that he would step down from his post and at a moment's notice. And I think we have to trust this process that, these vaccines have all gone through the systematic phase 1, 2, and 3 clinical trials. There will be very close monitoring for adverse events and side effects. But we recognize that there still will be reluctance on the part of some people to get the vaccine. And my hope is that with time, as more people in the general population take it and we see benefit and a good, side effect profile, that more people will be encouraged to do so.
Okay. I've got one more though. So if these disease trends continue, what's going to happen?
Well, let me pull out my handy crystal ball, Dr. Hatcher. Yeah. You know, I think our biggest concern is really healthcare system capacity. You know, we're doing some planning even this week to sort of look at how those numbers are trending, and we've done some extrapolations pulling in numbers from best and worst flu seasons, thinking about how the beginning of flu season on top of COVID numbers, you know, could really place a strain on hospitals. And so I think that's the primary focus. But I think, you know, we also have to consider that, you know, more schools are going to have to shut down if there's, you know, a high degree of community spread. You know, there will be other repercussions. And so, you know, we really all want to work together to try to get the amount of community transmission down so that we can, you know, preserve some semblance of a holiday season and keep our children in schools and keep the economy reopening the way that we have without potentially risking that. But sort of ravaging uncontrolled spread of disease puts all those things at risk.
Okay. There's fairly long chat message there.
I see that. Yeah, I mean, I think this is a great, I mean, not a great, an unfortunate anecdote about, you know, when many of us sort of live and operate in our own sort of bubbles, right? We interact with a small number of people at home or in our community and at work every day. And when people outside of that bubble are allowed to come into it without taking any precautions, then it potentially puts those folks at risk. And so, you know, you don't want to like exclude people and be fearful, but I think you can also take some fairly, you know, straightforward precautions like, you know, maintaining 6 feet of distance and wearing a face covering and some other fairly straightforward measures that can really help protect people, you know, when we have those bubbles mixing.
Okay. All right. So we better move on here. We appreciate the update.
Yes, sir.
And Dr. Smith, you're up next.
All right. Can you hear me, Commissioner?
Yes.
All right. Can you see that screen as well?
We can.
Perfect. All right. Well, I'll go through this reasonably quickly. I'm just going to give a quick update on what we're seeing in terms of prices, government payments, and then talk a little bit about general economic indicators. So one good thing you can do, Mr. Commissioner, is you can check your retirement portfolio. Today's been a very strong start. The Dow is up about 1,100 points. So we've pretty much got all indices so that they're back well above where we started the year, which is a definite positive. When we look at commodity-specific prices, we did see weekly weighted average prices for steers and heifers come down a little bit, but they trended back up this past week, and hopefully that continues to follow through. When we're looking at Class 3 milk futures, we did see a tremendous step back just as we moved from the contract month in the nearby. And when we look further out, there is definitely some weakness in milk prices as we move forward. Hogs has been very good in terms of what they've done since August. And we've started moving sideways a little bit. A lot of the recovery has been based on strong export sales and then weather. We'll get into some of those numbers in a little bit here. When we look at kind of our row crop commodities, this is where we've seen a real dramatic positive, where we've moved out of those growing season trading ranges of 825 to 930 for soybeans and 310 to 360 for corn. Right now, in terms of Tennessee cash prices, above $11 and above $4.25 for corn and soybeans. So again, those numbers are very positive relative to where we were through most of the growing season. So it gives some opportunity to sell the 2020 crop at a bit higher price than what we were anticipating, you know, even 3 months ago. So that's a real positive in terms of what we've seen in terms of price reaction. When we look at wheat and cotton, again, cotton's maybe not quite where we would like it to be, just right around that 70-cent mark, but wheat has been very strong, well above $6, giving us some opportunities to potentially hedge or pre-price some of our 2021 production. We'll talk a little bit about, just really quickly, what's driving some of these price increases. And so there's two primary drivers right now. The first one is weather. The second one is export sales. And so when we look at weather domestically, unless you're talking about our winter wheat crop, there's not a real strong influence right now. Yes, we've had some challenges leading up to where we're at right now. But as of right now, we do have that drought that's in a big chunk of the plains. But what's really driving the weather market is some issues that we see across the globe. Obviously, when we look out to Ukraine and Russia, there are some challenges out there that's affecting their potential wheat crop. Down in South America, it's an interesting case right now. They were delayed because it was so dry down there, and now we've ended up seeing them slowly get caught back up in terms of where they are for their soybean and corn plantings. So again, that's really important because that's really going to have a strong influence how our export sales progress as to what happens with that crop down in South America. So when we look at export sales, this is really important right now because this is really what's driving a lot of our commodity markets. Me and Dr. Mohammed are working on a study right now where we're looking at, does outstanding sales translate into actual exports? So again, when we look at these graphs, accumulated exports, the easiest way to think of it, I'm going to oversimplify this, is these are product that's been shipped. So it's physically left. The sale has been more or less completed. And so you can see for each marketing year, what you're looking at is the peak. That's what we'd end up having in total exports for the year. The one that's very interesting right now is outstanding sales. So these are sales that have been generated, but they have not yet been shipped. And what you can see is for soybeans, right around 26 million metric tons. So again, when you translate that into kind of what the pace is, we're 81% of what the USDA currently projects in terms of for the whole marketing year, which again runs September 1st to August 31st for soybeans. And typically about this time in the marketing year, we're only at 53%. So again, this is really what's propelling those prices upwards. We're seeing some fantastic sales to China. This is the China graph, but in terms of all exports, we're well ahead of the pace. Similar thing when we look for cotton, we still have high outstanding sales numbers. Our export sales pace is a little bit lower than where we would like to see it, but still overall is reasonably positive. Corn is one where there's been fantastically strong export sales to China. When you look at this graph, we're up around that 8.6 million metric tons in terms of total outstanding sales, with already 1.7 million tons shipped, which is a fantastic pace given where we've been in previous years. Now, we typically don't send a lot of corn to China, as can be seen from this graph, but again, it's really driving these prices in a positive direction, and so that's been a very welcome surprise. Now, one thing that is tough to kind of disseminate between this is this a good faith effort by China to come in and try to get close to those phase one targets? Or is it driven by multiple other factors where they're looking at building up some stocks, or maybe some of their stocks aren't at the levels where they're currently projected, or there's some quality issues embedded in those stocks? It's obviously not just the crops. When you look at beef, this is fresh, chilled, and frozen muscle cuts. Obviously, we don't have a strong track record of exports to China because there was some restrictions there. But as you can see right now, we're already at an all-time high in terms of export sales, so 21,000 metric tons of actual sales, and another 25,000 tons of outstanding sales. So very positive. But the big one has been pork. When you look at fresh, chilled, or frozen muscle cuts of pork, almost 600,000 that we've already shipped. Another 106 that's currently in outstanding sales. So again, very positive export picture is what's driving a lot of these prices. When we look at government payments, this has been another one that's been very welcome to a lot of our producers. We wrapped up the CFAP1. These are CFAP1 payments. There's still a few adjustments going on right now, but $132.7 million is what's been distributed to Tennessee. through that portion of the program. And when we look at CFAP 2, which we're still in the sign-up period for, another $116 million distributed to Tennessee producers. So both of those, again, are very positives in terms of helping mitigate some of the effects that we did see through the COVID-19 pandemic here. And so again, this is something that has been very helpful in terms of being able to get some cash into the hands of our producers so they can continue to spend and have that circulate through the economy. When we look at kind of general economic indicators, we're trending positively. One thing that you will see in a lot of these graphs is we're starting to see the rate of improvement slow a little bit. So when you look at Tennessee unemployment, 15.5 back in April, we're down to 6.3 in September. We're not where we want it to be, but it's moving in the correct direction. Same with national unemployment. So that's a positive. When we look at continuing versus initial claims, again, we're not back to where we were when we started, but we're moving in a positive direction. Now we'll have to wait and see with this latest flare-up as to what ends up happening in terms of unemployment claims and how we end up progressing. But as of right now, we're moving in a positive direction. Monthly retail trade. I believe President Boyd ended up mentioning this. You know, we have ended up seeing actually some pretty good retail sales and food service numbers. We're actually above where we were nationally in terms of before the pandemic started. But what's happened is we've seen kind of an adjustment between categories, and that kind of shows up in some of the data and right where you would expect it, right? So food service and drinking places still well down, but they've been improving month over month, but we're starting to see that rate of improvement slow a little bit. So again, we'll have to see moving forward how these numbers continue to come out. We're still about $10 billion lower than where we were before the pandemic started. Obviously, the counter to that is grocery store sales, where again, we've seen that dramatic spike during the lockdown, and then we've kind of started moving flat to down in terms of those sales, but we're still well above where we were before the pandemic. When we look at gasoline sales, again, we've seen this sharp drop, continual improvement, but again, that rate of improvement is continuing to slow. So we'll have to see how that impacts demand going forward for gasoline. A lot of that is going to be driven through any policies that are implemented as we move through the rest of the fall and into the winter here. So just in summary, you know, positive, we are seeing some of our key commodities with prices that have dramatically improved over the last 6 months. The government payments have definitely been very welcome. I cannot say enough about Director Mayfield and his team in implementing these programs. It is amazing to see how well they've done, not just with the CFAP programs, but all the other programs that they have to roll out. They've done a fantastic job given some very challenging circumstances. We are continuing to see the economic recovery, but that growth in the recovery is starting to slow a little bit. And, you know, as we all know, you know, it depends on how we move through this fall and winter flu season as to, you know, what's going to end up materializing in terms of economic activity. So there is still a massive amount of uncertainty that is out there. The last one that I'll just kind of throw in here is, you know, we don't know necessarily what the new administration's priorities are going to be in terms of agriculture, which I think is going to be very important moving forward. But also equally important is with the election, there's been some change-ups in the ag committees. So again, who is put into those positions and what type of priorities they're going to have, we'll have to wait and see. But I think that's going to be something that's really important as we move forward. With that, if there are any questions, again, I will distribute the slide because I know that's a lot of information in a short time.
Thank you, Dr. Smith. That's really overall probably the most positive report you've given.
Yeah, no, it's been from the stock market to the price improvements to the policy. You know, this has been one of the better ones in terms of economics that we've seen over the last 6 months for sure.
Okay, thank you. I'm not seeing any questions. We'll move on to Keith Harrison.
Can you hear me, Dr. Hatcher?
Yes.
Very good. Well, good morning to everybody. Just about 3 or 4 things I wanted to cover. Number one, on the personal side, many of you are aware and have reached out to me. Unfortunately, myself and my entire family have COVID-19. We are in quarantine at my home in Watertown, Tennessee. Unfortunately, my 88-year-old mother and my 90-year-old father have it too, and they are in St. Thomas West in Nashville, responding to treatment and doing quite well. But I bring that up, number one, to ask for your prayers, but number two, I just want to tell people, please be careful out there and follow the guidelines that Dr. Phil and others have told you about. And we're going to get over this, and we're going to be fine. And I sure do appreciate your thoughts and prayers. Just a word or two now. David Arnold sent me from Forestry just a few things that they are focused on over in that department. The community remains very focused with 3 major, the forestry community remains very focused with 3 major priorities. Diverse, competitive, and sustainable forest markets are the best incentive to make and to offer forest landowners activity to manage their forest land. So they're very focused on economic activities. Workforce development is a big priority, as well as trying to do what they can to improve the logging infrastructure of our state. And the forestry industry has been extremely appreciative of the opportunities that have been offered by the Coronavirus Agriculture and Forestry Business Fund, and they appreciate Commissioner Hatcher and Governor Lee's support of that. Speaking of the fund, we are working very hard to distribute the $55 million that has been approved for 800 different forestry and agricultural businesses across the state. We have received requests from funding requests from around 850, about 750 of those businesses thus far. And somewhere in the between 40 and $50 million has been requested, and those are due tomorrow. So our business consultants are working with those businesses to get those submitted, and we're going to evaluate how much money has been committed, so that if there's an opportunity to redistribute some of that money, we will before the end of the year. Thus far, we've paid out about 27 different companies requests for funding, somewhere under $2 million out of that 55. So we're working on that and doing our best to get those funds out there. In addition, we're working with the approvals that have come on the supply chain enhancement portion of this program, and just specifically the meat processing applicants, to give them some flexibility as they are making improvements in their facilities during the winter months, because we recognize that sometimes it's difficult with the weather, but we've contacted them and we're pursuing very much to that end. We're very, these investments we're making, Dr. Hatcher said this many times, are going to make a difference for Tennessee, the ag and forestry industry. In 5 and 10 years from now, we're going to look back at this and we're going to be really glad we made some of these investments, and I appreciate everyone's support of this program. Dr. Hatcher mentioned the ag enhancement applications. We were so surprised, pleasantly surprised if you would, that we had 7,525 applications for ag enhancement. We appreciate everyone's continued support of this program, and we're doing our best to evaluate all those applications and get that information out to folks as far as their approvals in December. So kind of bear with us as we go through that. And that's my report, Commissioner. Everybody be safe, and may God bless.
Thanks, Keith. And just to point out, I mean, we live in a state that allows us to have that kind of investment in ag enhancement, and this CARES money for ag and forestry businesses is just incredible, because I don't know of a comparable comprehensive program like it in the United States. So, I mean, we're fortunate to have Governor Bill Lee supporting that in the financial stimulus accountability group. So it's a wonderful thing. Let's see. That's not Jeff Aiken on there. That's Radon, I believe.
That's right, Dr. Hatcher. Good morning, and good morning to everybody. I think Mr. Aiken's probably on the phone, but not in a service area where he felt like it was reliable enough for him to actually be the one speaking. Three things I think we have to report today. The first one, on Wednesday of this week, we will be having a breakfast event in Greenville with a congressman-elect up in the new Congressional 1 district, Diana Harshbarger. So if any of y'all are in the area and would like to be a part of that, just let us know. But we've got several farmers from all of the counties in Congressional 1 that will be having breakfast with the congressman-elect that morning to talk about issues that are important in the ag community. Then later in the week, on Thursday and Friday, our public policy team will be hosting our resolutions committee here in Columbia to prepare recommendations for our state convention on policy changes based upon all of the information that was collected at our 12 policy development meetings and our questionnaire that followed that up. So the resolutions committee on Thursday and Friday. And then we are planning on moving forward with our state convention, although we think it will probably be significantly scaled back in the number of people who attend the convention, but we are planning that for early December 6th and 7th. We've reduced the number of days, but we'll be going forward with it, and particularly the voting delegate session on December 6th and 7th, which is Monday and Tuesday of that week. So those are the big and upcoming things within the Farm Bureau world. Thank you, Commissioner Hatcher.
Thanks for Donna. And I believe there is Mike Mayfield. I see him.
Good morning, Commissioner Hatcher. How are you this morning?
Good morning. How about yourself?
Yeah, I was somewhat technology challenged again in getting the camera on. I just did get that on just in time. Again, I want to say first off, thank you to Aaron's comments about program implementation. And I certainly can't take any credit for that. The field level employees have done a tremendous job and have gone way above and beyond to get these programs implemented. I certainly think it has been very impactful in the state of Tennessee as far as economy is concerned. I know the commissioner and I talked about this a week or so ago, and currently throughout the year, we're approaching very close to $1 billion in loans and direct payments that have gone out. I think the number I looked at this morning, we're at 969 million that are out the door in those particular areas. So I think those have definitely been impactful here in the state of Tennessee. The CFAP 2 is currently going on. We are currently 23,566 applicants. That has already surpassed CFAP 1 by a little over 2,000 applicants that we put through the first round. We have already exceeded the funds that were spent in CFAP 1. Currently, we have issued $123,741 and some odd cents through that particular program. That's only 19,000 of the current applications approved and paid. So we still have somewhere in around 4,000 applications that are sitting to be processed and paid. And of course, sign up will continue to go on until December the 11th. So please continue to share information about CFAP 2. Amazingly, we've had some persons attending some of the Tennessee Cattlemen's Association district meetings recently, and we still get comments that they weren't aware of the fact that cattlemen of all types were eligible for these programs. So we continue to push to make sure that everybody is aware that they are eligible, and any assistance that you all can give us to continue to get that word out, we certainly would appreciate that. We did wrap up the WHIP Plus sign up, which had to do with excessive moisture and flooding that affected 18 and 19 crops. We did wrap that up at the end of October. However, for those that were still pending applications that we didn't complete, we created a register. So we do have a large number of applicants that we will still be processing over the next several days and weeks to complete the WHIP Plus sign up. Again, that is a program that generates quite a few dollars per acre for those that are particularly eligible for that. With those two things, that is the primary work we've got going on today. We will be working with the new acreage programs, ARC PLC, in the coming future. And again, I appreciate this opportunity to share information. And if anybody's got any question for me, I'll certainly be glad to respond.
Thanks, Mike. That's a lot of money coming into Tennessee, isn't it?
It's a tremendous amount. It has been very overwhelming to be candid in the amount of work that it's taken to get those out the door. But my staff statewide has done a tremendous job to accomplish that mission.
Yeah, thank you. Jim Tracy, if you're on, you may need to star mute, or star 6 rather, not star mute, star 6. Okay, you may not be. We'll go to, I think Rob Holland is on. Are you on, Rob?
Yes, yes, sir, I am. Can you hear me?
Yes.
Well, good morning. I want to thank President Boyd for mentioning our Farmer Stress Grant and our Dairy Business Innovation Initiative grants. And I want to thank Dr. Smith for his great report. I think you can tell from his energy and enthusiasm that our extension programs continue during the pandemic for sure. And as fall harvest really kind of comes to a close for corn and it really heats up for cotton and soybeans, so do one of our most important agriculture programs that has to do with our many different variety trials and crop trials. So our agents are in the field and heavily involved in those programs. Most all of our county extension offices are open in one way or another, either under maybe what we would call normal conditions or by appointment only. But our extension programs continue statewide in various forms. Many of you are familiar with many of our master's programs and certificate programs. Master Beef, Master Farm Manager, our bee quality assurance programs are well underway. We are in the short rows of our Master Logger program. We still have 2 of those Master Logger training sessions that are planned for the rest of the year. We will be implementing our Master Row Crop Producer program in January, and plans are underway to develop a curriculum for Master Poultry. So our extension programs are alive and well, just operating in a little bit modified schedule like most everything else, but things continue to go quite well as we try to adapt to a new normal. Also, while I have the opportunity, I want to congratulate Dr. Hatcher. He'll be recognized November the 20th for receiving the Tennessee chapter of Gamma Sigma Delta's Alumni Award. So congratulations to you, Dr. Hatcher, for that, and thanks for the opportunity to provide an update on behalf of UT Extension.
Well, thanks, Rob. All those master programs are a great benefit to us here at the department. So thank you for adding it, and all the new ones that are coming on. That's just really good. So thank you for that. Are there somebody I overlooked or anybody that has some final comments? Okay. Tina tells me the next meeting is December 15th at 1 p.m. If there's a particular speaker that you'd like to hear from and get some information from, please let Tina or I know, and we'll try to get them on. But you know, these meetings are very informative to me. I like them, and I really appreciate Dr. Phil and Dr. Smith and all the others that give the very important updates. So until next time, we'll see you. And I guess happy Thanksgiving. But being that said, be careful out there. We generally have a lot of common sense in ag and forestry. So let's continue to apply that and lead by example on preventing further disease transmission. So we'll see you guys later.